Welcome back to another episode of the Pain, Performance, and Pohada podcast. I'm your host, Dr. Nick Smith. I'm a licensed physical therapist and strength and conditioning coach for Jiu-Jitsu and other combat athletes. If you're watching this on YouTube, got a little different ambiance today. Typically behind me, I'm rocking the green lights. Today, we are going full Mace Windu. We're going purple. Purple belt, purple everything. All purple everything. Because I need purple belt to be my identity. And quite frankly, I just want to mix it up today. Today's topic, we're going to talk about strength training and we can give you some tactics on where to start. Maybe you're somebody who has been stuck in the same routine for a while. Maybe you're a grappler who's, just kind of go with the flow of things. Maybe you see some exercises, you're piecing things together, but you're not exactly sure, how can I build this out to make this work for me for Jiu-Jitsu? And I'm going to let you tap into my brain a little bit and some of the different things I really like to focus on. And, these are general guidelines, of course. Each person is going to have a different goal. They're going to come from a different level of experience. They're going to come with, different access to different equipment. But generally speaking, there are some things that I really like to try to emphasize. And I want to kind of categorize those for you guys. So then when you are building something out, or maybe you want to try things on your own, this is where you can kind of start. Ultimately, I think working with a coach is going to be the fastest way to do this. It's why I've hired a coach myself, to free up that brain power, to give somebody else access into what I need to do. But ultimately, finding somebody who understands the sports and demands of jiu-jitsu or whatever it is that you're participating in. Maybe you're listening to this and you play another sport, but making sure that your program is tailored to the things that you need to be able to do. If you are planning on running a half marathon, things are going to look a little bit different than somebody who needs to prepare for a jiu-jitsu match. And I've had the luxury of being able to be a strength coach for a lot of different sports. Although I primarily focus on grappling and combat athletes, I've had experiences with NFL players, MLB, NBA, professional motocross, triathletes, Ironman, you name it. I've worked with it. BMX racing. So, and everything under the sun, quite literally. And everybody's going to have some foundational movements that I think that everybody can benefit from. And then where the nuance comes in is some of the accessories and maybe some of the things you're coming into with maybe previous injuries, or maybe just the specific demands of the sport. So I'm going to use jiu-jitsu as kind of we're going to use that as the guideline for today. But if I were to categorize how you should approach your strength training, I would break it down by just foundational movement patterns. So you're going to have a press, a pull, a hinge, a squat, and then some kind of plank hold, some core stability, rotational type things. That's where I would start. So squat, hinge, press, pull, twist, or rotate. With that, let's categorize those a little bit more. A squat could be back squat, front squat, scissor squat, lunges, barbell, dumbbell, kettlebell, anything, whatever. Hinge is going to be, your deadlifts, RDLs, back extensions. There's a lot of different things you could do there. Then we're going to get into press. Press could be vertical press, horizontal press. It could be barbell, dumbbell, kettlebell. It could be push-ups. It could be plyometric push-ups. For pulls, it could be dumbbell rows. It could be kettlebell rows. It could be barbell rows. It could be pull-ups. It could be inverted rows with a barbell. I mean, you can see where I'm getting into the nuance and what's crazy, and we'll dive into that. And then you have, your rotational stuff. Rotational could be, plyometric type of things. It could be anti-rotational core movements. It could be med ball tosses. It could be rotational kettlebell swings. I mean, endless, quite literally endless. The whole point is to kind of address things in all the different planes of motion. So you have sagittal plane motion, which is just like most of your front squat stuff. squatting, forward. You have frontal plane motion, which is going to would be like a, oh my gosh, I'm drawing a blank on this, but like, like a side lunge essentially, but working side to side. And then your rotational stuff is creating rotational forces. So it could be anti-rotation, meaning you're moving one aspect of your body while trying to keep something controlled, or you're actually rotating your spine, to throw a med ball. So taking those should be your kind of your foundation, and you're trying to hit those things, hopefully twice a week. Then this is where things get it's hard because there's a lot of things to hit. Then on top of that, I would really try to aim to make sure that for your lower body movements, your squat and your hinge, that you're trying to implement some level of single leg of that variation. So for example, you might have a back squat on one day, a reverse lunge on the other, or you might have a deadlift on one day, and then you're going to have RDL, single leg RDL. But trying to make sure that you implement your leg work in having both an upper single leg and bilateral, unilateral. For your presses, it kind of depends on what your goals are, right? Vertical pressing and horizontal pressing are both important, especially for jiu-jitsu. Pulling, always helpful. Horizontal pulling, vertical pulling, it's important. Whether you're pulling gis, collar ties, whatever it may be. So implementing at least one of those in some of your workouts is really important. And then that's where I would say, like, if you were to start there, you'd pretty much cover your bases. A lot of people, you'd be surprised, don't actually do single leg work. You'll be like, I sometimes do some lunges, or sometimes I'll do some Bulgarians, but it's like once every 6 weeks. So taking those and really implementing them and being serious about it, and whatever your routine is, ideally trying to do that for at least 4 weeks consistently. I prefer more, but let's just say 4 weeks. And you have the same routine for 4 weeks, and you're trying to hit each muscle group essentially, twice a week near fatigue. And reps and sets are going to kind of vary based on that fatigue level. For example, if I go with the lighter weight and I reach fatigue at 20 repetitions, it's going to be very similar to, at least in terms of hypertrophy, gaining muscle size, as opposed to doing, say, maybe a 5 rep where I'm reaching near fatigue. Now, if we're trying to improve overall strength, like I'm trying to move more weight, we're going to try to aim for maybe a little bit lower rep range and try to get those numbers up. Unless your goal is to get as much weight up as possible for 20 reps for whatever reason. If that's a personal goal of yours, then great. So once we've kind of had those essential movement patterns, foundational movement patterns kind of covered, the second category or second tier to this is kind of addressing what are the specific demands of the sport and what are some things that maybe commonly come up in injuries or areas of weakness. So built into that, I also really like to do a lot of direct arm work. I think direct arm work is super important for being able to maintain squeezes, grips, various holds, grabs for the sport. So I do like doing curls. Bicep curls are great. They help you with your squeeze for your chokes. Working your triceps is going to enhance your press and your framing. So doing direct arm work is good. Plus, it's good for health of your elbows. So on top of that, I like to do a lot of direct neck work. Your neck has an incredible amount of demand put on it between collar ties, being pulled down from your lapels, if you're a gi, yes gi, no gi, and making sure that you have a strong neck. Neck injuries are very prevalent in the sport, so making sure that you're nice and resilient for those things is super important. So focusing on some direct neck work. And then also, I'm a big stickler about direct groin work. Groin injuries, groin strains are so prevalent in the sport that I really, really like to implement some level of direct groin work, whether it's usually just Copenhagen's, usually covers the job. Sometimes it'll be some elevated split squats or some other sagittal plane motion, but I like to do a lot of frontal plane, adduction work with the Copenhagen's to directly work on the groin. And then category C, assuming you don't have injuries, A and B will kind of cover it. C is where things get a little bit complicated, and this is where my lens and my approach to strength and conditioning is maybe a little bit more varied than towards another strength coach is that I really like to focus on getting direct joint work based on previous injuries. So if somebody comes in and they have a history of back pain, I'm going to have something for that. If they have a history of shoulder pain, I'm going to have something for that. If they have knee problems, I really want to emphasize a lot of the single leg work and the things that they need to have done. On top of that, if there is previous or current injuries that are going to have day-to-day, maybe some mobility or activation exercises that they're doing as their personalized warm-up before they go train. But when it comes to strictly the strength and conditioning, I want to make sure that there is things that address the weaknesses that have come up during my exam. And that's where maybe if you're writing this program for yourself, you might be like, oh, I'm just going to do some presses and some pull-ups, but my shoulder still hurts. It might be helpful to get a little bit more help than just building it out yourself. Now, in terms of structure, we've given you kind of the foundation of what things you should look for in terms of the movement patterns, maybe even go a little bit further into some direct work for making sure that you're implementing things to reduce injury, including groin injuries, neck injuries, back injuries, some core work. Now I want to talk about splitting this up. How the hell did we split this up? I love full body workouts. There's a reason for that. Full body workouts, especially for the grappler, is a great way to split up, cover all of your bases of the things that you need without directly destroying one body group. For example, Universal Chest Day is on Mondays, right? So if you do chest and triceps because you're doing your bodybuilder's bro workout, you might have some pretty intense soreness over the next couple days because you just completely destroyed your chest and your triceps in this particular workout. Whereas if I were to build this out for a grappler, you might have some chest, but you're also going to have legs. You might have some direct work for your neck. So if you do have a little bit of soreness, it's going to recover pretty quickly, and you could essentially repeat it the next day. If you're doing like a crazy leg workout, I hear about this all the time, like, oh, I did legs and I can't sit on the toilet. Like, okay, well, was that helpful? Like, what if you needed to get some mat time in the next day and your legs are cooked? You don't have any explosion. You don't have, you can't play guard the same way because your hips are super stiff. You're uncomfortable at work. Whereas if you had taken some off the top, done some legs to dry the stimulus, worked some other regions, and then you can go train the next day and you feel pretty good. That's how I want the strength training to kind of be built out. So I have, a main and an accessory of upper body, a main and accessory of lower body, and some kind of core movement. And that core movement could include some neck direct work. It could be a combination of core work with groin work. And then I'm usually building that out anywhere between 2 and 4 times a week, depending on the demands of the grappler. If they're a twice a day, 5 days a week type grappler, not going to have as many sessions in the gym. If there's somebody that can only train, say, 2 times a week, maybe 3 times a week, I'm going to be kind of pushing it towards that 4 times a week, at least in terms of lifting. And then also varies on what's your schedule, how much you work, you got kids, all those things. The other aspect of this that I really try to implement, but this does add some nuance to it, is making sure that you're implementing some level of sprints or plyometrics into this. If I'm getting somebody brand new started, I may not get plyometrics in right away because I'm trying to build a base. But once you kind of get into your groove, that can be part of your lower body experience. You could do bilateral jumps, but then you can do some single leg RDLs, to target your single leg work, or vice versa. You can do single leg hops and then do, a deadlift, but if you're going to categorize that in time, putting the plyometric first, sprint plyometric works is always first. Get that energy system worked out before you get into your strength stuff. Just adding that in. But that's kind of how I would give you a little breakdown of how to do your strength training. I would really focus on the movement patterns first, making sure you're covering those bases. If you do that, you got the meat and potatoes of things. You're probably going to get, I'm giving an arbitrary percentage. I can't verify this with research, but let's just say that that's going to cover about 60 to 70% of the needs of the majority of people. Then that next layer is going to be kind of the direct joint work. That addresses the specific needs. That's where the nuance of working with a coach is going to be really helpful because they can kind of pinpoint what things to work on specifically, what exercises would suit you. Not just doing the things, but like, hey, this exercise I think would be best for you given this scenario. And then that other small piece that kind of, even though it's a small slice, it dictates the rest of the, the pizza, so to say. that small percentage, if you're injured or have an injury or a previous injury, that could maybe dictate what you can and cannot do in the gym. If you have a shoulder issue and flat bench press with a barbell is painful, or you can't get above a certain weight, you're going to want to work on that injury first. That would be important to give you the access to be able to do whatever you want for your strength training. So making sure that those things are addressed first, or at least integrated within your program, is wildly important and not something that I would really overlook. It might be something you consider when you are looking to maybe look for a coach. It's making sure those things are addressed, making sure everything is taken care of. When I'm working with each one of my athletes, always ask, even if they don't come to me for rehab problems, they're coming to me strictly for performance, I need to know about previous injuries or anything that's banged up. Because if I go through a movement assessment and I see something, I want to make sure it's addressed or at least integrated within the strength program to make sure that they get the support that they need. So as always, this is something that does have a lot of nuance to it. There's no black or white answer to it, but given the categories that I've kind of given you, making sure you can follow those tiers, it's something at least to get you started. And maybe you do have some additional questions, or maybe you're like, dude, this is too much to think about. I need the guesswork taken away. A lot of people need that. They just need somebody to tell them what to do. They show up to the gym, they lift the weights, they reap the benefits. I'm always here to help out. This is what I do. I address everything. Everything is very holistic in that making sure that you stay healthy, making sure that you're performing the best on the mats, whether you're a competitor or just somebody who just wants to kick ass in your hobbyist class. Totally fine too. But making sure that we're setting you up for success and it's something that's sustainable for the rest of your life. This isn't just like a shot in the pan, like, I'm going to do a camp and I'm going to do this for 6 weeks and then not do it anymore. The way I build these out, it's supposed to be like building blocks where we have a great foundation of everything. And it's something that you could quite literally sustain for the rest of your life, training into your 70s and 80s if you want to. And you have something that keeps those joints healthy. It keeps you strong, keeps your muscles strong, tendons, ligaments, everything. So you can just do the thing. But if you're somebody who needs a little bit more guidance or a little bit more nuance, you know where to find me. In the show notes, you can contact me directly. We can hop on a call and see what it is that you need and see how I can potentially help you out. That's the end of this episode. Until next time, remember, pain is a privilege, not something you should fear, just something you should respect. See you in the next one. See you.